Once again, good day and welcome to our pharmacology online class with me, Sir Choman, as your lecturer. Our topic is geriatric pharmacology, which can be found in chapter 11 of our main reference. Geriatric pharmacology. As a result of the specific physiologic characteristics of the older adult, most medication doses are less than middle-aged adult doses because of changes in metabolism and excretion. Doses are generally decreased to avoid accumulation and toxicity. Polypharmacy is more common in the older adult. Polypharmacy means taking many drugs together. Two major organs affecting drug clearance from the body that should be closely monitored when an older adult client is receiving multiple drugs are liver and kidneys. These are the organs primarily responsible for metabolism, and excretion. Hepatic blood flow in the older adult is decreased, thus possibly causing a decrease in drug clearance. This results in decreased excretion of the drug. With a change in hepatic blood flow, there will be impaired drug metabolism. This leads to decreased excretion, increasing the risk for accumulation. Because older adults may have less efficient medication elimination, monitoring for accumulation is an important component of nursing care. So when a nurse is administering a medication to an older adult client, the nurse is aware that the client's T1 half or half-life is longer than those in middle-aged adults. The nursing intervention indicated by this premise is monitoring the client for signs of accumulation. Effects of selected drug groups on older adults. Diuretics, like the diuretic hydrochlorothiazide, HCTZ, or hydrodiuryl, is usually prescribed for the older adult in a lower dose. HCTZ is a potassium-wasting diuretic, so continuous use or high dosing of HCTZ can cause increase in potassium loss. An older adult client is ordered to receive digoxin. Digoxin is a cardiac glycoside. Digoxin slows and strengthens the heart. Toxicity may be manifested by bradycardia. Take note, in NSAIDs or non-steroidal anti-inflammatory drugs like ibuprofen, Motrin, the nurse should teach the client not to take the medication on an empty stomach. An antacid may decrease the gastrointestinal side effects of the NSAID. It may also impair absorption, so it must be evaluated for effectiveness. There are many factors that are likely to decrease drug adherence in the elderly. One factor that can cause non-compliance in the older adult is a decrease in finances or the inability to pay for the drugs. Other factors increase adherence to a drug regimen are the use of a weekly drug divider container, taking daily drug doses in the morning or twice a day, and no visual or hearing impairment. For our health teaching, when client is demonstrating signs and symptoms of disorientation, the nurse would ask questions like, "Are you taking any medications?" This is an appropriate question related to medication use. A new medication may be associated with changes in sensorium or other behavioral characteristics. This should be evaluated. That ends our geriatric pharmacology discussion. Let's proceed with practice question number 1. Physiologic changes of aging that can affect drug activity include all of the following except increased fat-to-water ratio, decreased liver enzyme production, loss of nephrons, and D. Increased gastrointestinal blood flow. The answer is D. Practice question number 2. Adverse reactions and drug interactions occur frequently in older adults due to all of the following, except A. Consumption of numerous drugs due to multiple chronic illnesses. B. Drugs ordered by several healthcare providers. C. Increased incidence of allergic responses. And D. Self-medication with OTC preparations. The answer is C.